Carlos Nelson with Cascade Media Group. And today, our guest is Dr. Shelley Cooper. Shelley works in the telehealth field. And I think that that's a very important subject for our audience, and especially my African-American audience, getting involved with the internet and going where the health profession seems to be going right now, not just in the future. Welcome, Doc.
Hi, glad to be here. Thanks for having me.
Hey, Dr. Cooper, can you expound on what telehealth is and how it works for our audience?
Sure. Let me give a little bit of a backdrop of it. The field of telehealth has been around for over 50 years. It just hasn't had a lot of attention. When I entered the field of telehealth back in 2012, I earned my doctorate in instructional technology and distance education, which is delivering a service from a distance. So when we think about the field of telehealth, it's kind of like an umbrella. And in that field of telehealth, there is what's called telemedicine, which is when a doctor or provider speaks with a patient using encrypted network, and they have to have a certain type of reimbursement. They also have to have a certain level of licensure. They have to be located in certain places. Only certain types of things can take place. You can't get a needle stick through the internet. You can't perform a surgical procedure through the internet. So telemedicine is one leg of the telehealth table. Another leg of telehealth is delivering healthcare education from a distance. So I'm active with what's called Asthma Ready Communities out of University of Missouri. So we relay healthcare related information that has to deal with asthma virtually over the internet. And we deliver that information from one location to several locations. And that's what's called hub and spoke. I know it's a lot of terms, but like a wheel, the information comes from one place and shoots outward. Another leg of that telehealth would be considered remote patient monitoring. And some of your audience members probably use this. This is when they might have a cardio problem. They might have a problem with their heart. So they might wear a heart monitor, and that heart monitor relays information to their cardiologist or their primary care physician in another location. Or maybe they're having trouble with their diabetes, so it relays their A1C to another location. Or maybe it even has to do with asthma. So there are a lot of different ways you can relay that information. The main thing to remember with telehealth, the umbrella is delivering healthcare from a distance using secure networks, the patients in one location, the providers in another location. That's the main thing to remember with all of those different examples.
Well, you have enlightened me on two key elements in telehealth that I would have never given second thought to. The encryption, mm-hmm. and you talked about the telemedicine.
Right.
And these are one question I would like to ask you, if you know about this, who is using telehealth at this point the most? I when I look at this remote thing, I look at rural areas. I'm saying that's the first thing that pops into my mind. Mm-hmm. But you're the person that would know more than I. Tell us who's using these features at this point.
It's being used all over the world. NASA Space Center uses it. They have to use telemedicine. They used to have telehealth when they speak with the astronauts out in space. It's used on the battlefield because in different military situations, they've got to be able to care for the wounded on the battlefield, and there may not be a surgeon, whoever they need there. So they have actual robots that can be operated from a distance to perform surgical procedures on the battlefield. When people think about telehealth, they immediately think, oh, we're thinking of a rural area where there are sparse populations and there are very few healthcare providers. That is the case, but that's not always the case. What we're trying to do in the field of telehealth is close that healthcare disparity gap that's caused by people not having access to care. So yeah, in rural areas, there are fewer providers there. And so they do need to have access to care virtually or through the internet. But the only thing that keeps them from doing that, one of the few things I should say, keeps them from doing that is lack of broadband access. So if they don't have the internet, they can't get access to telehealth. And usually those providers, according to CMS, the Center for Medicare and Medicaid, dictates that the provider has to be licensed in the state where the patient is located. There's some waivers because of the public health emergency we're under right now with the pandemic. But normally the doctor needs to be licensed in the same state where the patient's located in order to prescribe and also to create a health plan. And also, when we think about people who need to have services done, that provider has to have the level of license so that they can provide those types of services. So it's not just the rural areas. And you might think, okay, here in Kansas City, urban areas, there are hospitals all over the place. But we also have to think about, does that person have transportation? Do they have the financial resources to get to the doctor? Can they take off work without losing their job? Does their child or family member have a chronic illness that requires repeated visits to the doctor? Those are the ones who can really benefit from telehealth because they can stay where they are and visit the doctor. The doctor doesn't have any windshield time and have to go to the patient. The patient doesn't have to go to the doctor.
Hey, Dr. Cooper, let me say this. You're killing me because the questions that I was getting ready to ask you, you hit on the nail because you made me put my thinking cap on, as they used to say in high school. I said, I thought rural, but this is really for the mass population. And because as we go forward, economics are going to play a part, the transportation because when I have to go to the doctors, now the one that you didn't get that I'm going to try to get out of you, how has the medical field adjusted to telehealth? Because I had prostate issues, cancer about 1.5 years ago. Mm-hmm. And when this C-19 came in and doctors weren't seeing people and, all of it was new. Mm-hmm. How have the medical profession, the individuals adapted to this new technology? It's not new technology, but
adopting this new technology. Well, I'm glad you asked that because part of, and I'm gonna go back to the dissertation that I wrote, the benefits and barriers of telemedicine adoption in the Midwest. That was my topic back in 2014. And I was beating down doors trying to get people to understand you don't have to take a half day off to go to the doctor. The doctor doesn't have to drive 50 miles outside of a metropolitan area, service area, to see everybody. This can be done virtually. And so I don't know if you remember my office upstairs, we would talk and I'm just going everywhere trying to find and explain to people, you don't have to do medicine this way. And so there was a lot of hesitancy. People weren't sure, are these real doctors? Do they have real licenses? Are they in real doctors' offices? How do I know who these people are? But when we think about our most recent medical appointment, unless you had a critical or chronic disease, or you had something where you had to have hands-on-hands touch, the doctor pretty much talked to you. They read the vital signs, but unless they had to put hands on you, about 70 to 75% of those appointments were just talking to a medical professional, which can be done virtually. So fast forward from 2014, when I finished my program, to 2019, beginning of March, everything was fine. March 2019 or March 2020. Okay. March 2020. Yeah. And so But the second week in March, when COVID hit and everything shut down, a lot of the majority of patients who needed to have elective surgical procedures had to put those on hold because they weren't performing them. Regular medical appointments like you talk about, it was difficult for you to get in to see your provider. And even if you were able to get in, you had to go out to the parking lot and then call them and let them know you were in the parking lot waiting. They would escort you in because the waiting room was empty because we could not have people there who could possibly contract and also people who might be able to spread COVID. And so the whole mindset changed. Then suddenly, oh, telehealth, maybe telehealth can help us. So to answer your question along the way, the roundabout way is the medical profession is implementing telehealth, but it was a flip of from Friday, you came in and you saw your doctor, to Monday, no, we can't see anybody and we're doing the best that we can. So bubble gum and Band-Aids and all of that, trying to, and rubber bands to put together a way that medical professionals can see patients. So they adopted it and they implemented it because they had to. And now that people are able to step back and say, okay, well, that really wasn't the best way for us to do what we needed to do. Now we actually need to have this procedure in place in order to be compliant with HIPAA guidelines, which is privacy for the patient and their information. You might see data breaches that you've heard about. So it's really real. Now I think people are really understanding this is a viable way for people to see their doctor. Medical professionals are adopting it. They're tweaking it. They're doing what they need to do to make it work for their own individual offices.
I tell you this, I'm the type of person, and I know it's stupid, but I hate going to the doctors because you sitting in that office possibly for, well, they've gotten better over the years. You'd be sitting there an hour and a half, and all they doing is talking to you. When you get in, they'll take your blood pressure or what have you, but they're talking to you, and you traveled. Time is money, and right. I see this really as a game changer. And what I would like to let the audience know, Cascade Media Group in 2019, they here usually they have a tech week, but we put our own tech week on at the Negro League, and Dr. Cooper participated in Tech Week, and we had mostly quite a few of the people of color that are in the technology industry, from the Cerners and Black and Beaches and the Burns and McDonald's there. And we invited a half dozen kids from Lincoln, from Ruskin, from Crossroads Academy. And we did our first streaming, and Dr. Cooper was in Arizona at a telehealth conference. Right. And we had one of my classmates that's over Howard University's, both their technology campuses. Dr. Cooper was, and this shows you the power. She was in a cab on the way to the airport as we were streaming, and she was talking to the students and to our host, Burton Kelso, and a couple other things. But she had another doctor in the cab with her. Mm-hmm. And the doctor was, and it just shows you how small the planet is even. And she kept saying Mr. Nelson, or using my first name, Carlos, or what have you. And the lady said, "Is that Carlos Nelson?" And, right. You know, using these technologies. And that's one of the major things that Cascade Media is about. And I talked to you about our community, is plugging in to things that are going to make your life easier. And that you started in 2014.
Right. I started Diversity Telehealth in 2014.
Right. And to me, it's the same thing trying to get us on communications, on digital communications. That's a long time. And
Right.
and you haven't, we're just breaking the surface. And I don't even think the surface would have been broke had this virus not broke out. And the major shot callers said, we got to do this Zoom and make everybody do it. And now it's passe per se.
It's a part of life. It's everyday life. Now, when you get an invitation for a meeting, they ask, is it in person or is it Zoom? At conferences, same thing. And one thing I wanted to touch on, you brought up a really important point when you talked about how this is everyday language now. And you also talked about when you go to the doctor, you really don't like sitting in the doctor's office for an hour. Well, let me touch on that. The main reason that most patients have to sit in the office for over an hour is because the doctor's office may have had an emergency and they have to allow for that patient. But a lot of times it's because they double and triple book. And the reason they have to double and triple book is there are so many no-shows. And when there's a no-show, then the patient doesn't receive care. No one else receives care either because that slot goes unused. And also the doctor doesn't get revenue. And one thing I don't know if people realize, but a doctor's office is judged on certain measures. How many chronic disease patients are they seeing? How many behavioral health appointments have they had? It's a lot of different measures that they coordinate with the quality of insurance and NCQA, I think the name of it is. So the reason I bring that up is I've been doing a lot of work with Swope Health, and we've got a collaborative partnership going on here. And one thing that we noticed is a really high no-show rate. And at the time, when I was working with them and helping them with their telehealth solutions, unfortunately, my father passed away very, very, very suddenly. And he had a doctor's appointment scheduled for just a few days after he passed away, but he didn't make it. And so in my thinking, I thought, okay, there's so high no-show rates, 25%, 1 in 4 average are no-shows. So that patient's not being seen, but there's telehealth available where you can have on-demand doctor visits. So I combined the idea of resolving that no-show rate, closing the healthcare disparity gap by trying to get access to care for people who don't ordinarily have it, and also bringing in telehealth. And so I created a platform, an app that now is called Come On Now. And what the purpose of Come On Now is to allow people to see their doctors whenever there is a no-show. So when there's a no-show at your doctor's office, the Come On Now platform will contact you through the app and allow you to take advantage of an empty slot that was left by somebody that had a no-show that didn't show up. So that way, chronic disease patients and other patients can get access to care on their phone. The doctor can recoup the revenue that would have been lost from a no-show, and the medical organization can increase their compliance measures, and they're seeing more patients. So it's a win-win-win all the way around. So that's what I created in the last year and a half.
I'd like you to send me a copy of your app if you'll forward it,
sure.
So that I can put it into your interview. This is, you have illuminated quite a few things in the last 5 minutes. I would have never thought about the triple booking and why that. Mm-hmm. I would have never thought that was even being done, first of all.
Yeah.
And you've talked about the other side of the health profession mm-hmm. on a couple of different levels that doctors have to deal with. And mm-hmm. boy, I didn't know that. Now, this is the other question, because, I keep going back to we're a Black network, basically. And mm-hmm. how do you feel that the African-American or the diaspora is using these tools versus the majority community?
I don't think it's used as much in the African-American community. And the purpose, my mission of Diversity Telehealth and you can see it on the banner back here, is bringing healthcare to all communities, especially underserved and underrepresented populations. As we know, people of color are more likely to get or contract any type of disease that is either incurable or leaves a terrible result. Cancers, heart attack, stroke, diabetes, all of the major morbidities are contracted by African Americans. We live in neighborhoods with higher levels of pollution. We don't have access to care, or if we do have access to care, we don't have the finances to keep that up and to afford the medications. We mostly have jobs that don't allow for us to just take off work in order to go to a doctor's appointment. And since we have higher levels of chronic disease, our children have those diseases, so we would have to take off work to make that happen. We make less money, so we don't have the car, so we rely on public transportation. It takes 3 buses to get to the doctor. So all those dynamics, also known as social determinants of health, also impact the healthcare of African Americans. So when I try to introduce telehealth, we also have to look at, okay, how many have phones? Well, if you might have a phone, but if it takes data to use the app and you have already partitioned out how much data you're going to use for that month based on your budget, you might not have the money to get into the app. So, and then also African Americans are less likely to have an internet connection in their homes. And so that creates a whole new idea of, okay, the digital divide. Not only do we not have access to care online, we don't have access to healthcare education online. So we can't get those memos, and it's less likely for us to go into the patient portal that our doctor's office offers us. And so when we look at all of those different dynamics and the impact that it has on healthcare in the African American community, and adding COVID-19 to that, we don't have the healthcare information. So they're listening to somebody say that, oh, getting the vaccine, they're putting a chip in your arm, ridiculous, and other types of misinformation. If you don't have access to the real information, you don't have access to the healthcare providers to make you feel better and live a better lifestyle. It's a bad situation. It's just a terrible situation. So, but we can do better. We can make this situation better for everybody. What I'd like to encourage people to do is find out about telehealth access at their doctor's offices, at all the federally qualified health centers around town, SWOPE, Sam Rogers, Casey Care, Vibrant Health, all the others, and even your own private healthcare organization. Do they offer telehealth? How do I get to it? Normally, it doesn't cost any more than a regular doctor's appointment. And with Medicare and Medicaid, reimbursement has been more widespread. You're more likely to be able to get that at a reduced cost.
Well, I would like to really thank you for coming on today, Dr. Cooper, and we look forward to working with you in the future on our health and wellness channel, because I think you laid it out concisely across the board for the general public and issues that are facing our community itself. I really appreciate you coming on, and we look forward to working with you. But what I would ask you in closing, do you have any closing comments for our audience?
Well, I do actually, and thank you for this commercial break that I'm going to throw in here. I'd like for you to visit diversitytelehealth.com is the website. On that website, you will see not only the app that I've been talking about, but you'll also see other ways that you can use telehealth. My company provides Teledoc, which is a way to connect with a doctor on your phone for as little as $11.99 per family. Your whole family can have access to telehealth, and also discounts on prescriptions and dental and pharmacy and vision, vision, pharmacy, and dental. And in addition to that, Diversity Telehealth Community Network, which is my 501c3, I raise money and give it away so that people can have Teledoc membership so they can have it for their families. And I work with True Light Family Center, and also the homeless. Different homeless organizations can get free telehealth through Diversity Telehealth Community Network. My number is 913-710-3818. Again, the name of my company is Diversity Telehealth. The name of my app is Come On Now, and it's accessible through the Google Play Store and the App Store. So talk to your physician about adding Come On Now to its offerings at your physician's office.
All right. This has been a very enlightening, and I think I know a little bit about something, but Dr. Cooper, you really laid this out.
Thank you.
And as I said, we look forward to you giving us some illumination on some other subjects as 2022 proceeds. And as we always say in closing, when you invest in your community, you're really just investing in yourself. Good day.
The program is brought to you by the Kansas City Business Association.